There are always two sides to every story, and psychiatry isn't excluded from this. In this video, I'm going to be going over the dark side of psychiatry, so stay tuned. Welcome back, Psych Dude family. It's good seeing each and every one of you guys today. So, like I mentioned, psychiatry has definitely two sides of their story. There's the good side and there's the dark side. And in this video, I wanted to talk about the dark side. It's something that a lot of people don't shed light on. And honestly, if psychiatry is something you want to get into, and being a psychiatric mental health nurse practitioner, I definitely went into psychiatry wanting to make a difference, wanting to make an impact. And obviously, I've experienced the good, and obviously I've experienced the dark side. And like I said, I wanted to shed more light on the dark side because psychiatry isn't for everyone. So let's get started on the dark side of psychiatry. And the first thing I wanted to mention on the dark side of psychiatry is when you work in psychiatry, you're gonna have to deal with extremely agitated, irritated, and maybe even combative patients. And it can happen on a daily basis, on a weekly basis, on a monthly basis. You're never gonna know when it's gonna happen. And unfortunately, people don't necessarily shed a light on this because they don't necessarily want to show you this part of psychiatry or this part of medicine. And if you are in a psychiatrist, or if you're a psychiatry resident, or if you're a psych nurse practitioner, or a psych RN, or LPT, you're gonna have to deal with this because these patients show their symptoms this way, and certain disorders have symptoms of these combative nature. And I wish I could tell you like, oh, you're never gonna have to deal with these type of patients, but you may come across this patient regardless of which setting you might be in. If you're an outpatient, if you're inpatient, if you're in the skilled nursing facility, you're in the urgent care, you may have to deal with these type of patients, and you may come across working with some disorders like this, and it might not be the patient's fault. It just might be the disorder within itself, either responding to internal stimuli, or hearing voices saying to hurt you, or hearing voices to say they hurt themselves, and you have to respond and keep the patient safe, or the staff safe, or the other patients safe. So this is one of the things that I want to shed a light on and to be able to bring out into the public, because this is something that we can and may have to deal with on a daily basis. And unfortunately, I've been spit at. I've been someone attempted to punch me, and someone attempted to punch another staff member, and we had to respond in a certain way. The good thing about working psychiatry is that you have different methods of trying to protect yourself. So there's CPI, which is Crisis Prevention Intervention, something like that. Crisis Prevention Institute, where they teach you methods on how to actually keep yourself safe and staff members safe, and how to properly help the patient whenever they're in a combative state. Or there's the MAB, and then there's also PROACT. So you'll be able to learn these different modalities, methods to help whenever patients are aggressive and you need to either restrain them or manually restrain them, or things like that. The second thing that I want to shed a light on and the dark side of psychiatry is you're gonna have to deal with addiction. And as many of you know, addiction is deadly in a sense that they cannot help themselves. They are so addicted to either a certain medication, a certain drug, and the amount of, or the behavior that they present it's tough, and you have to deal with this. And sometimes people become med seeking, and they're gonna come to you wanting medications. And if you're a psychiatry resident, a psychiatrist, or a psychiatric nurse practitioner, you're gonna have to deal with this. And there comes a time where you may have to deal with this and have to actually wean them down on their medication, and they're not gonna want to wean down. And their body craves this medication so much, or craves this drug so much, that they can't help themselves mentally, and you're gonna have to deal with these behaviors. And these behaviors might present themselves in irritableness, in aggressiveness, or just outright anger. And you have to be able to stand tough, stand your ground, and be able to treat these behaviors. But and the other side is, once you're able to help their addiction, once you're able to actually treat the patient and control their behaviors, it's a beautiful thing. But people don't necessarily shed a light on this behavior because addiction sucks. There's so many different people out there that suffer from addiction, and there's some people out there that you have to deal with that suffer from this, and they may come to you med seeking and demand a certain medication, and if you're not going to give them that medication, they're just going to get super irate and either be aggressive with you, have outbursts towards you, yell at you, things like that. And I wanted to be able to shed a light on this because people don't necessarily talk about this. All you hear about is the good, how you're helping someone that was depressed turn their life around, or you're helping someone that was extremely anxious turn their life around, or helping someone that has psychiatric outbursts and you want to help them turn their life around, or having psychotic symptoms and turning their life around. But people don't necessarily talk about addiction, and addiction is out there, and I thank God for the specialists that treat addiction because they're one of a kind, they're special. And yeah, it's something we have to deal with. It's a big part of mental health because you never know what they're treating in terms of why they're addicted to a certain medication. They might be self-medicating because they didn't receive the mental health treatment that they should have had. And yeah, I want to give more information in terms of, you're going to see that in psychiatry, regardless of which type of psychiatry you work in and which position you're going to work in, you're definitely going to see this. The third and final thing that I wanted to shed a light on the dark side of psychiatry is, unfortunately, you're not going to help everyone. You're not going to completely heal everyone. And as much as you want as a psychiatric provider to help every single person, to help restore their life, unfortunately, there's certain things that are out of your grasp and you have no control over. You can do as much teaching as you want, as much education as you want, as much medication management or therapy as you want, but you're not gonna help every single person. Of course, there are those one-offs where you could help people to the best of your ability, but it might not happen for every single person you deal with. And I just wanted to shed a light on this because people constantly think that medications, therapy, those are going to be the biggest things that are going to help everyone, and it really is. But there's certain external things that we can't help, and they may have to deal with that, unfortunately. And honestly, I don't mean to be a Debbie Downer, but this is the reality of working in psychiatry. Is these three things are probably the biggest things that I've countered, and it took me a while to kind of understand. Is you have to deal with the aggressiveness of the patients. You have to deal with some of the symptoms of the patients, and these symptoms of the patients might come out as combative, aggressive, irritable, things like that. And the nature of it is, you have to deal with it in psychiatry, and I wish they would have told us a little bit more about all of these three things that I mentioned, because it would have been easier. It wouldn't have changed my mind, obviously, of working in psychiatry, but it would have helped us mentally prepare to actually work in psychiatry, right? So another second thing that I wanted to mention, like I said, was the addictive nature of certain medications and addictive nature of people, and you having to deal with people that are med seeking or people that are withdrawing, things like that, and the behavior they have, it's tough, especially in the beginning when, well, as a nurse, you can see all of these things, but they don't necessarily direct their behaviors towards you. They direct their behaviors towards the provider. So they're either psychiatrists, psychologists, or the psychiatric nurse practitioners. But when you switch into the role of being a provider, then that's when things start to head towards your way, meaning they're gonna be combative or irritable or be angry at you for not providing them the medication that they want, and being in certain situations when you don't want to just prescribe them the medications because they might be on another controlled substance, or they might be on other medications, and them coming to you wanting medications or having early refills. They're just going to be so irate at times that they're going to just be so upset and yell at you. That's pretty much it. And you don't necessarily know how to react in the beginning, and people don't necessarily tell you about these things because, let's face it, no one wants to hear it, especially when they're trying to sell a job or sell a position. And I wanted to give more light on it. And the third thing is, people tell you so many different solutions. There's so many medications out there for certain diagnoses, and there's so many different modalities to help with certain diagnoses, but they don't necessarily tell you that some of these things might not help. Yeah, there's treatment-resistant depression, so you have your ECT, you have your TMS, things like this, but they don't necessarily tell you that some of all of these things might not even work, and you just have to constantly go back to the drawing boards, and you're gonna have to feel like a failure at times because you want to help someone so badly, but you can't help them at times. And this is something you have to deal with, and I wish that they would have told us this. But yes, you want to have an open mind because you want to help everyone to the best of your ability, but sometimes you have to kind of accept the, not necessarily defeat. Of course, you're going to do everything in your power to help them, even if you can reduce the severity a little bit, but sometimes you might feel like a failure because you might not help them, may not help someone to the best of your abilities or how much you want them to. But yeah, I figured I wanted to make a quick video on this. 3 different things that I've encountered with being a psychiatric nurse practitioner for about 1.5 years that I found kind of troubling and that I didn't necessarily know going into the job field, especially as being a provider. Well, I hope you guys found this video helpful, and I hope it shed a light on the dark side of psychiatry. I hope it's going to help either psychiatric nurse practitioners, family nurse practitioners, psychiatrists, psychiatric residents, things like that. I hope this helps you out in some shape or form. If you have any questions, concerns, please comment down below. Don't forget to subscribe, and don't forget to give this video a big thumbs up, and follow me on Instagram at the Psych Dude. As always, have a wonderful day, guys. Bye.